full game link in there so you can practice on your own. So we have some interesting questions in the full game, right? So tomorrow we're going to look at transplantation and cancer. So if after we talking about that, if we have time, we could make full game in the classroom. If you do not have time, guess what? You can do the full game on your own, right? So that's one of the resources kind of fun, right?
Yes.
See, right? So I just want to remind you guys available for self-practice. Another thing is if you look at in week 8, right? In week 8, we do have additional resource help you to read, right? For example, hypersensitivity. We're going to look at hypersensitivity. Guess what? We have an amazing video, type 1, 2, 3, 4. So whatever the topic we discussed today is hard for you to understand, you could read the book or watch a video. If you still have questions about that, you can come back tomorrow, ask me questions. How about that? Yes? So we have lots of resources to help you study. Besides the lecture, we have a George to know it, lecture, so all those could help you. Yes? Okay, awesome. Just want to remind you guys to utilize resources in the Blackboard. And if you're a reader, you can read a book. Any book will be fine. Any book have those chapters. Yes? Or if you're a visual learner, we have tons of video help you to see the process. Okay? So, and visual learner, or if you learn by doing it, the draw to know it could be better. Okay? So that's a resource. You guys have any questions? The final exam will be cumulative. Final exam will be cumulative. So you can imagine, today, this week, we can learn disorder in the immune system. Because before the midterm exam, we learned the detailed information about immune system. Yes? So this is a good opportunity. This week's learning material is a good opportunity to review our immune system. Yeah, because the final exam is cumulative and the board exam is cumulative. Yes? Okay? So, any questions? Right, so that's a reminder, inundation, right? Inundation. I'm wondering if you guys, right, working on the literature review? No. Week 8. Week 8 review next week. You got to start working on it, right?
This week is 8.
This is week 8, right? You week 9, yeah? So I just want to remind you guys, so you got to start the homework assignment seriously, right? So you cannot finish this assignment just the last day, yeah? Okay?
You can try.
It's smelling so
Try to start now.
helps wake you
So
up.
that way, you can submit one more time. If you start now, you submit something, you have questions, you can ask. Yes, and you can submit one more time. I will look at the last submission. So you can keep submitting, keep modifying it, and if you have questions along the way, I'm right here. Yes, so it's a good idea to start now instead of last minute, someday. I now look at my phone all the time, yes? So, you said, all right? So it's better to start now so you can ask me questions, this time. Okay? Sounds good. So everyone going to start thinking about this all right?
Don't breathe too deeply.
Right, you already
Don't
finished
bring
the
it too
research
deeply.
part, you know how to find the
Trust me.
scientific literature, yeah?
That's what
Okay,
I felt.
so that's what I can think of the reminder.
It's a good time, I like
Any
it.
questions? So you continue to do the weekly quiz, discussion, lecture, yeah? Plus this assignment, okay? So that's if you don't have you don't have question, I will just go ahead and go into the week 8. So first disease we're gonna look at first group of disease we're gonna look at is hypersensitivity and autoimmune disease. You guys download the file? Okay, ready? Okay. So let's look at the review of immune system. So innate immune system include what? Everyone, innate immune system include what? Right there, right? First line defense is what? Skin, mucous barrier, and normal microbiota, your genetic makeup, yes? Second line defense is what? Phagocytosis, right here, phagocytosis, complement system, fever, inflammation, interferon, yes? Second line defense, the other part of cell-mediated immunity, humoral immunity, antibodies? Yes? Okay. So if everything work out correctly, this is a success story about immune system. Vaccination, successful vaccination, you have you recover, you have immunity, right? You have immunity, either it's natural or artificial immunity, yes? What else? Transplantation, you also can produce monoclonal antibody, yes? Okay, the monoclonal antibody, we can use it for all kind of therapy, right? Therapy for cancer, for the autoimmune disease, etc. Yes? Now, however, if the immune system is not working correctly, cells miscommunicated, what's going on? What type of symptom associated with disease in the immune system? Yeah, hypersensitivity, autoimmune disease, right? Immunodeficiency, opportunistic infections, cancer. All this is come from what? Dysfunction of the immune system. Make sense? So that's like a big picture wise, yeah? So because we learned the immune system can be very complicated, they have to really coordinate, fine tune. If that process is not done correctly, you have a disorder. Yes? So now, first group disorder we're going to look at is hypersensitivity. Right? So this is a really good summary. So now you learned the cell-mediated immunity, humoral immunity. Yes? You guys still remember? I'm just trying to review as we're talking about disorder in the immune system, we could review the immune system a little bit, right? The normal function of the immune system. We learned the cell line defense. Cell line defense based on mechanism. There are two types, right? Humoral immunity, cell-mediated immunity. Yes? Now we're going to look at type 1. Based on mechanism, they have 4 types of hypersensitivity. It's well studied. Yes? So which type of hypersensitivity due to the dysfunction of the humoral immunity? Type 3. What else? Which type of immunity related to the disorder associated with humoral immunity? Type 2, type 3, type 1. So type 1, 2, 3, 4. They are the disorders associated with what? Humoral immunity, because associated with what? Antibody. IgE, IgG, IgM, immune complex, right? Which type of immunity is associated with disorder of cell-mediated immunity? Type 4. There you go, right? So you can see it. And then once this, the immune mediator is produced, then you can recruit additional cells, the eosinophil, the basophil, neutrophil, mast cell. Then based on which cell you recruit, then you have distinct symptoms. Okay, right? So this is a really good summary. We're going to go through for type 1 first, right? Type 1 first. So first of all, which antibody involved in type 1? Everyone? Which antibody? IgE. Everyone?
IgE.
So IgE is involved in which type of hypersensitivity? Type
A.
1. Yes? Okay, awesome. Okay, now we sort that out. And then, besides the antibody, who else also involved? Cytokines. Yeah, cytokines involved. Right? So your eosinophil could be involved, and IgE also could include basophil mast cell. Okay? Now, the cytokines involved in produce IgE is what? 4, 5, 13, tumor necrosis factor alpha, right? You have chemokine, colony stimulation factor. Yes? Now, so that's the molecules involved in the type 1 hypersensitivity, right? And then, which T helper cells involved to regulate B cell produce IgE? Guys, you remember? T helper 2. Yeah, there you go. We're going to review T helper 2. Yes? T helper 2 helps the B cell produce what? IgE. Right? That's the beginning of type 1 hypersensitivity. Yes? Now, the example of type 1 hypersensitivity is allergic to plant pollen. So we just finished the spring, right? Right now it's summer. So you guys remember during the spring, a lot of people are allergic to plant pollen? Yes? Already. Right? Okay. So now, have you wondered why people said, oh, I'm allergic to plant pollen instead? Oh, I have an infection. I'm sick with plant pollen. Have you heard like people say, oh, I'm infected with plant pollen. I'm sick. Or you said, I'm allergic to plant pollen. Why? What's the difference between allergy versus infection? What's the difference? So let's think about it. So, for example, the infection will be Staphylococcus aureus infection. Yes? Folliculitis. So, which time period you're going to get sick? When you have Staphylococcus aureus infection. When you infect primary infection. Yes? So, primary infection, during the early stage, you have symptoms of inflammation, fever. Yes? So, you get symptoms during the primary infection. Right? Primary exposure. However, allergy is the first time primary exposure, you have no symptoms. And the second time, the later subsequent exposure, then you have symptoms. That's allergy. That's why when you have symptoms associated with allergy to plant pollen, that means you already exposed to it last year. Yeah. So that's the difference between infection versus allergy. Make sense? Go up in the second time, second or thereafter, instead of first. The infection is first. So now we sorted that out, right? Now, if you encounter allergen during the primary exposure, what you get, you are sensitized. You are sensitized. So what sensitized means? Sensitized means during the primary exposure allergy, you activate the helper 2, you produce IgE. Once IgE produce, IgE do not like to be alone. IgE is like, I don't want to be alone. I always want to be with somebody. So as soon as IgE produce, who they want to hang out with? Mast cell and basophil. So mast cell, basophil surface armed with IgE. How do they bind? The Fc region. You see the Fc region antibody? You guys still remember that? Will be tested. And the board will ask you, can you draw the antibody FAB? Yes. Okay. So Fc region bind to the surface receptor on mast cells. So that state, this is called what? Sensitized. That means your mast cell basophil surface have something else on there. What do they have? IgE. Sounds good? You have no symptom, right? And then next time, subsequent exposure to the same allergy, guess what? You see? Right? So the allergy binds to the FAB region of the IgE, who's already on the mast cell basophil. So remember we learned the granulocytes. Who are the granulocytes? If I ask you a question, we could ask you again in the final exam. Who are the granulocytes? Will be what? Basophil, neutrophil, eosinophil, and mast cell. So mast cell, basophil, neutrophil, eosinophil, they are the granulocytes. So second time, the symptom comes from what? Degranulation. When the degranulation talking about whatever is in the granule or mast cell, basophil, after allergy binds to the IgE on the surface, they go to release the granule. When they release the granule, what's in the granule? Example, histamine, tryptophan, prostaglandin. Once it releases, this granule is going to do what? Vasodilation, contract smooth muscle, increases the gland production, the mucus, this, that, and that is something. So the allergy, type 1 allergy, the symptom comes from what? Degranulation of mast cells. Sounds good? Right? So over here, this is show you the symptoms, right? The degranulation. So there's some of the granules going to, constrict the bronchi. Some of the chemicals in the granule going to cause vasodilation and increase in degranulation of mast cell base. Sounds good? Right, let's review. Best answer is what?
B.
Which one? It's all of it. Yes, all of it.
She was right. She
D, right? I heard B or D, right? I'm just tomorrow. Make sure it's D, not B. Yes, all of this. And that's not all. Look at how many chemicals involved. Besides the histamine, leukotriene, prostaglandin, right? You have a bradykinin, cytokines involved in there, and the chemotactic factor for your eosinophil, neutrophil could be recruited, serotonin could be recruited, lots of chemicals involved. Okay? When these chemicals involved released, right? Then you have symptoms. Let's look at this question. Right, what's the best answer for this question? That would be a B, right? The second time you have degranulation. Yes? Sounds good? Right? So we hear summaries, right? So your first exposure, you have sensitized. Sensitized means mast cell basophil have IgU. Degranulation of mast cell basophil, that's H2. Now, so mast cell basophil, they are the immediate, so acute early stage, so mast cell basophil degranulation. In the later chronic stage, so IgE can also recruit what? Eosinophil. And later stage, you can also recruit the fibroblast, basophil. When you do all this stuff, guess what? So chronic, so early stage, you don't have a cellular damage. Chronic stage, you don't have a tissue fibrosis. Right? You have basement membrane damage, tissue fibrosis. Because a basement cell coming later. Especially eosinophil, we already know IgE can include eosinophil. Yes? Okay. So you see, depending on stage, symptom a little bit different. Right? Okay. So that's type 1 hypersensitivity. Yes? And then we're going to look at some examples. What are the examples? Type 1 sensitivity, localized one typically due to mast cell. Mast cell is in peripheral tissue. So degranulate mast cell in peripheral tissue, the example hay fevers, hives, asthma, eczema, those are localized. Okay? Now, sometimes the food allergy. So the food allergy is, this is also type 1. So depending on how you activate it, right? Some people are allergic to food as well. Now, this will be GI tract. Now, for systemic anaphylaxis, systemic anaphylaxis is due to what? Degranulation of basophil in the blood vessel. When you have degranulation of basophil in the blood vessel, now you have if you dilate the blood vessel, you do all the blood vessel dilated. When you do that, guess what? You have a shock, blood pressure drop, shock, and death. So the treatment for systemic anaphylaxis is what? Epinephrine. What's the function of epinephrine? Constrict blood vessel. So you have the degranulation of basophil, blood vessel dilation, blood pressure drop, you could die. But if you use epinephrine immediately, constrict the blood vessel, and then you can survive, right? Example, the people allergic to bee stings, right? That would be systemic anaphylaxis. And some people allergic to penicillin, if you do IV penicillin, that could be systemic. Yes? Okay. So, any question? Now you see, hey, why some people that's why they have allergy, some people have allergy of all kind of stuff, right? So what's the reason? So it's a couple of reasons. One is genetic, because if you default, the T helper cell default is T helper 2, you more likely have allergy because for type 1. Yes? Another one is environment exposure. So environment exposure, right now we have this hygiene hypothesis. Have you heard of hygiene hypothesis?
Yes.
Yes. We're talking about this in recent years. It could be over-reporting, over-treating, over-diagnosed, or it could be just really a trend. It's nowadays the American children more likely have allergy compared to the children come from 50s, 60s, right? Maybe they can realize it or just out of it, I don't know, right? But then they did a survey study, not scientific study, children, have allergy versus children without allergy, talking about the lifestyle or, household other stuff. They discovered the children, if they grow up with 2 or 3 pets, they're less likely to have allergy. Compared to the kids grow up with the perfect mother, with perfect job, clean the house, really perfectly clean. You know what I'm saying? So the hygiene hypothesis, talking about the normal microbiota, right, in the environment associated with animals, could teach your immune system like, oh, this is normal, don't overreact, something like that. But again, this is not scientific study, this is survey studies. So a survey study cannot establish cause versus effect. It's just the correlation. So in order to confirming it, you have to, we did the confirmation scientific study with the animals. Okay, so animals growing in a sterilized cage, you have a kind of, okay. So, but anyway, so you can see, even just being sanitized, the hygiene has to be in a certain degree, right? Okay. Now.
But I have a question.
Yes.
Is it the house, to clean house the problem, or is it more that typically parents are not allowing kids to like play outside?
That could also, basically, just like you're exposed to the normal microbiota associated with outside, associated with pets. Because if they have pets go outside, they're going to run stuff inside. No matter how clean you are, they're going to find stuff on bed, right? So basically, normal microbiota could help the immune system to have like, just like, oh, when you're young, you figure out that this is normal, that's not normal. So,
Daycare is good.
yeah, daycare, that you definitely expose all kind of in the daycare, yes. So anyway, so now over here, this is the kind of talking about we did a kind of follow up the patient, discovered for example food allergy. Food allergy nowadays the kids have like allergy to peanuts, it's very common, right? So and also nowadays we have genetic testing available, right? They discovered, for example, allergy to the peanuts actually starts not through GI tract. They discovered one of the protein called filaggrin. So filaggrin is a type of protein makes your skin really tight. Filaggrin variant is talking about some kids that have a different type of filaggrin protein makes the skin is leaky. When the skin is leaky, then the peanuts, whatever you touch it, obviously snack food always have peanuts. When you're touching it, then you get the antigen from there. And then once it goes through the sensitized T cell will go to the GI tract. And then the second time when you're eating it, you have problem when you start with GI, but you make sure the active comes out. And how do you get it? You can see it. Many years you can see the you have genetic factors in there, right? And then you have livestock exposure and the cat exposure and rhinoviral microbial infection also could promoting that. So multiple factors together, like a perfect storm, then eventually happens. Make sense? So it's not like just one gene or one factor to do this. Okay? So how do we identify the source of allergy? Do a skin test. Do a skin test, you can see the swelling, you can identify all your allergic disease or not. Skin test. So the source of allergy is based on the human, right? We could have allergy to the food, right? To the dust, and it could be coming from the drug being used, the injectable drug being used, or allergy, right? Contact, right? We have all kinds of sources. You have to do the skin test for that. Inhalation. For example, penicillin allergy is kind of pretty common, yeah? However, if some people say, hey, if somebody have a penicillin allergy, you do that, definitely work. That's type 1. So if somebody allergic to penicillin is happening, then you have this ID, that's type 1. However, sometimes some people are allergic to penicillin due to hemolysis. Because penicillin binds to the entity of the red blood cell, that's type 2. And sometimes penicillin binds to the small protein and have immune example is desensitization. You heard of desensitization? Or hyper is over hyposensitization. Yes, hyposensitization. It's talking about if you heard of kids have identified allergy, they can come back. They do the small dose, right? Repeated exposure, small dose for several weeks or several months. Yes, and then some kids eventually grow out of it. You heard of people have allergy, eventually grow out of it. Yes. So what's the mechanism? The mechanism is when you hoping because you naturally use a default, you cell-mediated immunity to helper 2, you produce IgE. So the hoping is when you do this desensitization process, you could start to use IgG. Once you produce IgG, guess what? IgG can block allergen bind to IgG. So IgG can block the deregulation. So once IgG can block the deregulation, guess what? You don't have symptoms. Yeah, because IgG is free antibody, so they can bind to the allergen before the allergen will bind with the cell. Yes. So this one is relatively cheap and less invasive, and the effectiveness depends on individual. Some people like maybe 15, 16% effectiveness, right? Some people go out with it, some people not, right? So you know that IgG can block the allergen to bind to IgG, so that way you can block the deregulation. So that's one way to do it. Yes. Another one is what? This is so this is a good slide. This is show you the step of type 1 hypersensitivity. You can just block each step. So you can just avoid it. You can avoid an allergy, right? Or you can use immunosuppressive medication, corticosteroids. You can block, reduce T cell, B cell activity. Or you can block the degranulation. Or you can neutralize the chemicals, antihistamine, aspirin, epinephrine. You can block the activity of chemicals from the degranulation. You see? Right? Or you can even use the antibody neutralize IgE so they won't go to mast cells. So multiple approach. Now, to use this slide, answer this question. Anyone? This is easy question. The answer is in this slide. Answer is right here. Answer is right here. Right? What's the answer? Yeah. Makes sense? So now you see why do we need to study the detailed steps so we can find the symptoms? Yeah.
E.
Right? So now that's type 1. Next one we're going to look at is type 2. Okay? So let's compare type 1 versus type 2. Okay? So which antibody is involved in type 1? IgE. Which antibody is involved in type 2? IgG or IgM. So different antibody, yes? So type 1 antibodies, IgE. Type 2, IgG or IgM. Okay? So effector stage. So for the effector cell in type 1 is mast cell basophil degranulation, yes? For the type 2, IgG, IgM, guess what? Bind to antigen, they are really good at activate what? Complement system. Antibody antigen binding activated complement system is which pathway? Which pathway? We have 3 pathways of complement activation. I'm just reviewing. 2 pathway. Classic pathway, lectin pathway, alternate pathway. Yes? Which pathway? Right? Activate complement system mediated by IgG or IgM. Classical pathway. Classical pathway. IgG, IgM. Bind to antigen, activate complement system. Once the complement system activated, what happened? We go calcium finally too. Complement system activation immediately, you have what? Increase inflammation. C3A, C5A. Optimization, increase phagocytosis, C3P. And the MAC, remember MAC cheese, MAC? C5B, C6, 7, 8, to the antigen associated with the cell. So you can write the cell number. Yeah. Sense? Okay. So now we kind of we have a discussion. Ask you guys compare, contrast type 1, type 2, type 2, type 3, type 1, type 2. How many questions in the discussion, right? So hopefully just by you guys discussing it, with each other, you can sort out, right? With type 2, what's unique about type 2? Where's the antigen located? Type 2 antigen located on the surface of cell. What type of antibody involved? Type 2, IgG, IgM. Effector molecular complement system or antibody-mediated cellular toxicity. Yeah. When the cell dies, then you have all kinds of symptoms depending on which cell type. Yes. So a lot of autoimmune disease we have type 2. Okay, we're going to go through that. Okay. So you can see it over here, right? So you see you can damage the cell, damage the tissue, and the function, loss of function. Okay? So now let's look at so IgG, IgM bind to the antigen associated cell, immediately activate the complement system. Complement system activation, one thing is macrophage, membrane attack complex, C5b. And another thing is the C3b recruit what? Phagocytes, phagocytosis. You see? Causes a lot of cellular damage. So now let's look at some example. Which cell in general have an antigen on the surface? Which cell? Which cell? Look at this. Which cell is on the picture? Which cell that typically have surface antigen? Have you heard of ABO blood typing? ABO blood typing. Yeah. RH. So red blood cell have bunch of antigen. ABO, right? So the O is the red blood cell have what? No A or B, right? Yes? That makes sense? Right? So it's ABO blood typing. We're talking about is once you have a blood transfusion, the blood type is not matched, guess what? Antibody to bind to red blood cell, especially IgM, immediately macrophage cell lines. See? Make sense? So let's look at the antigen on the red blood cell. Besides ABO, right? What else? RH factors. Yeah. So where do you get this ABO or RH gene? From your parents, yes? Okay. So you can use blood typing to figure out who's the baby's daddy, right? Yes. Right? Over here, yeah. And then the difference between ABO and RH is ABO, for example, you have A, type 1A, you automatically produce what? Anti-B antibody. However, if you are RH negative, guess what? You do not automatically produce anti-RH antibody unless you expose it. You see, that's the difference. Right? With the ABO, you have B antigen, you automatically produce what? Anti-A. For RH negative, they do not automatically produce. Okay? Unless you expose it. So this is the complex story. Let's look at the first group. Right? So if somebody have type B, then we have anemia, need blood donation, the mismatch in the type A. Guess what? See? Hemolysis right there. Yeah, hemolysis right there. Now, what about RH factor? RH factor is RH negative woman is at risk for what? For like a baby with hemolytic disease of newborn or erythroblastosis fatality. So what we're talking about is if RH negative woman pregnant with RH positive baby, if without any treatment, guess what? During the pregnancy, especially during delivery, so RH negative women are exposed to the RH positive blood. Guess what? They don't produce anti-RH antibody. So next time she pregnant with another baby is RH positive, guess what? Maternal antibody already have a RH factor antibody. So you're going to fool the fetus, red blood cell. So during pregnancy, less damaging because the fetus still get the is once the baby born, the red blood cell all lyse. So the baby, you have to do an immediate blood transfusion, otherwise baby. Yeah. How do we prevent that?
Different shots.
Yeah. So you give the during the first part, you have to give the pregnant woman the Mobius, that's the antibody against the Rh factor during the first pregnancy and every pregnancy. Yeah. Otherwise, another thing is the extensive analysis could cause brain damage, so the baby could use UV light to clear away the bilirubin channels.
Is that because the first time she makes IgM and doesn't make IgG, which can possibly symptom until the second time?
No, yeah, this is the IgM will be immediately after the conferences, but after the delivery first born, she's going to do it. Until second pregnancy, IgG can come. Yeah, the first time the baby already, when you baby out, the trauma, that's causing it. Yeah. Right. So how do we know? How do we know the baby have this disease, hemolytic disease of newborn? Which test? Nothing that you have. You do the blood test. So what you do is you need to do the blood transfusion right after if the baby have this condition. What you do is you do this what we call is a Coombs test. So you can do the blood drawing before the delivery. And then the Coombs test is talking about use anti-human antibody. So if the baby is red blood cell attached to antibody attacking it, use anti-human antibody, glutamate, immediately Coombs test positive. Then when the delivery, you already ready. Oh, we have everything ready, so you can see it. Right? Okay. So the Coombs test also is very useful for detect autoimmune hemolytic disease. Have you heard of autoimmune hemolytic disease? Analysis. The autoimmune disease damage red blood cell. How do we do the test? Coombs test. How do we do the Coombs test? Use what? Anti-human. So this is widely used in the clinic. So in case you have patient with autoimmune hemolytic disease, how do you know? Here's my blood test. You kind of the Coombs test positive. That means that you have autoimmune hemolytic disease. Yes? Okay. So now, let's look at this question. You guys agree? What's the correct answer? A, right? Yeah. Okay, good. Remember, yeah, I just want to make sure everyone agree, right? Okay. Awesome. So, hemolytic anemia, right? Besides the Rh, next woman, the pregnant, can be hard to divorce, right? Another thing is what? Drug induced. So how the drug induced are some people allergic to the medication, including penicillin, any type of medication. What they do is this medication they are hapten. You guys remember hapten? So on their own they are not immunogen, right? But once they go into human, the hapten could bind to the human protein. So if they happen to bind to the surface of red blood cell, guess what? Then they have a drug-induced hemolysis. Yeah, right? So you're not going to have type 1 hypersensitivity, rather it's type 2. Okay? Now, let's look at a picture, right? You see, if the penicillin or sulfonamide, any type of medication bind to protein on the surface of red blood cell, you see, right? That actively complement system recruits phagocytes, red blood cells. Right? Another one is autoimmune. They discovered autoimmune hemolytic anemia due to another antigen on the red blood cell called I antigen. So I antigen is we have a little in lowercase I, this is in uppercase I. We're talking about this type of antigen. So like when you during childhood, as we become adult, so this molecular structure of I antigen change. So they're going to produce antibody attack. That would be what? Autoimmune. Make sense? So where do you get eye imaging? Okay. Yes. So how do we diagnose? Somebody have autoimmune hemolytic anemia. How do we diagnose that? Which test, everyone? Which test?
Blood test.
Which type of blood test? Which type of Coombs test, right? This what type of test? Coombs test, right? And use what type of antibody? Anti-human. So it's kind of unique as a widely used. The reason I'm repeating it is because they use it routinely. Yeah. Sometimes, like when people have cancer, guess what? They have hemolysis. So they're trying to figure out that hemolysis due to cancer or hemolysis in autoimmune disease. So they do the Coombs test. If Coombs test negative, it's still hemolysis, they're going to investigate maybe serum. Yeah. This is part of the differential test. Sounds good?
So when you say Coombs, like C-O-M-B?
Right here. Coombs test. Coombs. Right here. Coombs test. Use anti-human antibody. Coombs test. So this one is so widely used in the clinic. I just want you to become familiar with it. So in down the road, if patient asks you for second opinion, you look at the blood test, you understand why they have blood test. We can interpret. We can help the patient interpret. Right? So any question? So we sort the map out, yes? Now, so let's review type 2 hypersensitivity. So type 2 hypersensitivity, which antibody is involved? Which type of antibody involved in type 2, everyone? IgG or IgM, right? What type of antigen associated with type 2 hypersensitivity? What type of antigen? Well, where do you find the antigen or allergen associated with type 2? On the cell surface. On the cell surface. So a lot of autoimmune disease, they are type 2 hypersensitivity because you produce autoantibody target on the protein on the cells. So now we're going to look at the example of type 2 hypersensitivity. They are associated with autoimmune disease. Okay? Sound good? So now, first of all, most people don't have autoimmune disease. Yep. Due to what? Due to what? Remember we compared the T cell, B cell, and then they go to the thymus, bone marrow, they go to stool. They have to pass the board exam over there, right? What type of board exam they have to pass? Negative selection. Negative selection. So they have to pass the board exam in the thymus or the bone marrow, right? T cell have to pass the board exam. I use board exam because you know what board exam is, right? So the T cell have to go to the thymus to mature, and then they have to pass what? Both negative selection, positive selection. Yes, the T cell. So the negative selection ensure what? Self-tolerance. And the B cell have to pass board exam in the bone marrow, which tests negative selection. So negative selection occurs in the bone marrow and the thymus. We achieve what? Central tolerance. T cell development in the thymus. So the positive negative selection for T cells in the thymus. Negative selection for B cells in the bone marrow. Right? After they pass the board, where do you go? They go to the peripheral tissue, lymph node, spleen. Yes?
Yes.
Right? So once they go to the peripheral tissue, you have additional mechanism for cell tolerance. Right? In the peripheral tissue, one side is Treg. Treg can produce immune response. Right? Another thing is what? Some of the antigen in the peripheral tissue is hide away, called the immune privileged sites. We're going to look at next slide. So some of the tissues in the antigens are hiding. So the T cell, B cell have no chance to look at it. So you can tolerate that. Another thing is what? In the peripheral tissue, the T cell or the B cell activation requires co-stimulating molecule. So you can use co-stimulating molecule to fine tune it, either allow activation or kind of also start to activate the apoptosis. So they're going to self-eliminate. So all these steps ensure what? Peripheral tolerance. Together, most times people don't have autoimmune disease because it works. Okay? So let's look at some reasons why people have autoimmune disease. So over here, this is the list of the tissue and organ in your body typically hide away from your immune system, called antigen sequestration. And so they hide out. So any type of tissue organ, they do not have a lot of blood vessels, right? They don't have lots of blood vessels, you know, the joint or the eye, the lens in the eye. There's not a lot of blood vessels in there. So you don't have a chance for the T cell, B cell mechanism. Yes, including the, you know, sex organs, you know, can imagine the meiosis, use all kind of cells, right? It's different from your own cell, yeah? Now, however, if the injury occurs in this tissue, guess what? Now your T cell will say, hey, never look at it on the assignment, so I was in assignments and you said bone marrow study, trying to graduate, I never see this happening. So when you have an injury in this site, then T cell, B cell might start activating and produce hormone. Can you imagine? Make sense? Yeah. So now,
to me, what hamster cheek
so the pouch probably, but any type of even an animal, in human, any type of tissue organ, they do not have a lot of blood vessels. Typically avascular tissue, the structure in the body, an animal, the hamster pouch probably don't have a lot of blood vessels as well. So that way, the antigen associated with those type of tissue and organs, we hide away from it. Make sense? Okay. Now, in addition, right? Another thing is promote autoimmune disease is what? Microbial infection. Microbial infection. Toxin, stress, right? Sometimes related to the food. You know, the celiac disease. Nowadays we have gluten-free diet. That makes sense? So the many reasons, right? So autoimmune disease typically occurs later. It's not like most of autoimmune diseases come later in life. Yes? Now, talking about infection. Another hypothesis of autoimmune disease is cross-reactivity. What is cross-reactivity? This antibody target on the microorganism during infection, you can cross-react with your own tissue. So the cross-reactivity, that's like after microbial infection, then you have autoimmune disease. So this is a list of well-studied. For example, we learned the Streptococcus pyogenes. Have you learned that? Do you remember Streptococcus pyogenes? What type of disease they cause? What? Strep, yes. Streptococcus pyogenes, where do you find it? Too much here. The most common disease is strep, right? If without the antibiotic treatment, patient could have what type of disease? Yeah, could be a rheumatic fever, pallus, right? Scarlet fever, glomerulonephritis, yes? The rheumatic fever we studied. Remember the M protein associated with the Streptococcus pyogenes neutralizes C3, so they can inhibit what? Opsonization phagocytosis. And then your immune system use antibody bind to M protein. Guess what? That antibody bind to M protein could cross-react with the antigen, extracellular protein associated with heart block. And if that happens, that's autoimmune disease. That's endocarditis. See? So under the type 1 insulin dependent, typically it's genetic, occasionally related to the measles, mumps, rubella, cytomegalovirus, revirus. Right? Hemolytic anemia, and some microbial infection produce cold agglutinin, for example, walking pneumonia, mycoplasma pneumonia, produce antibody neutralize red blood cell in a colder temperature. These two hormones. See? Right? We have research microbial infection, then antibody start cross-react with yourself. Depending on where they cross-react, they have different something. Again, this comes to not everyone has those conditions based on your genetic makeup. Yes. So this is from here. You see, some people say, you don't worry about getting sick. You get sick, you recover, make you stronger. Is that always true? No, because sometimes when you get sick, you recover, you get autoimmune. So it's not always true. Yes. Depends. Nowadays we all aware of the chronic disease. Have you heard of the healthy lifestyle, reduce inflammation is a big sign, right? Because chronic inflammation, look at how many conditions could result from chronic inflammation. You see, type 2 diabetes, right? Cancer, autoimmune, Alzheimer's. Yeah. So chronic inflammation. Yeah. So you see basically the development of autoimmune disease is multifaceted. Yeah. Now, let's look at some example of autoimmune disease in this table. Some of you heard of it, some not, right? Let's look at, lupus, systemic lupus erythematosus. That's a systemic disease. You have antibody target on the stuff inside the nucleus. In the nucleus, yeah. Rheumatoid arthritis, yeah, you heard of that, yes. Type 1 diabetes, Graves' disease, Hashimoto's disease, multiple sclerosis, yeah. So you get an idea, right? So now if you look at the autoimmune disease, the symptoms associated with what type of hypersensitivity? You see, majority of them is associated with type of hypersensitivity with type 2. Because type 2, what type of allergy associated with type 2? It's allergy or antigen associated with the cell. Associated with cellular. Make sense? Okay. Any question? So, you guys want to take a break? Then we're going to go through example of autoimmune disease, the antigen, antibody, B cell area. Ready?
Yes.
Okay. So we're going to come back at 4:05. 4:05. Okay.
Last time was kind of stressful. Yeah, it's good.
2015. In 2016, I was down there during the state living my best life. What, high school? 2020.
Just lie. Just lie. Just lie. Just trying to So I would disagree. I think I'm actually. But they both. Oh, I'm sorry. I also. You gotta remember, everybody's out. I say 20 all the time. Yeah, maybe not you, but like.
A lot of more things. Like, wait.
So Amelia, tomorrow you doing the Starbucks?
Bruh, how did you just go back to bed? You just go back to that.
I'm on
The way he said that, I mean, like, hey.
Is that the plan for tomorrow? Didn't you avoid my Starbucks like a couple months ago?
Well, actually, I'm not. That's about it.
The box is Chipotle.
Can you do me the service?
Sure.
Thank you.
But I'm not gonna be happy.
You're not gonna be happy about it?
No, I don't want to be happy about doing anything. Here,
You
hold on a
should
second.
be happy about everything. Quite the opposite.
There.
Thank you.
You're very welcome.
Now I'm gonna sit closer to you.
Sounds good.
Are you happier?
Much. Now I got this. Good times.
That's so funny. It's like a sniff.
It just keeps, it's aromatics of ammonia. Because that's what smells so far.
But is it like if you do it too much, is it bad? Yeah.
If too much of anything, it's bad.
Well, yeah, but some things are worse than others.
It can burn you if you like get up in your nose, but if you smell it, you should be fine.
Ammonia.
Yes. We could just
It's
start
good. I
now,
like it.
yes, so we can
Helps wake
go
me up.
quickly, so you guys can have more time, right? Relax, drive home. Sound good?
Yes.
Yeah, okay, awesome. Let's continue, right? So we're gonna look at the example of autoimmune disease. The symptom is what type of hypersensitivity? Type 2, right? So let's look at one of the disease you heard of is what? Multiple sclerosis. Yes? So the antigens come from where? Associated with what? Myelin sheath. Myelin sheath on the nerve fiber. You guys learn the structure of the nerves, right? We have myelin sheath, yes, lipid, yes. So the surface of myelin sheath, they have proteins. You produce antibody target on the myelin sheath. So if nerve fiber have damaged the myelin sheath, what happens? Yeah, the neurotransmitter signal cannot be transmitted quickly. Yes. So the symptom depend on which part of myelin sheath damaged, right? You have symptom. Yes, multiple sclerosis. Yes. So now, which sex more likely have male or female? Which most of autoimmune female more likely have. Okay, female more likely have. So the risk factor, besides being a female, what else? Right? Smoking. So if you have a smoker as patient, one of them you can tell them is what? Smoking could lead to lung cancer plus increased risk for what? Multiple sclerosis. Yeah. Smoking what? Smoking cigarette, yeah. Yeah, it's not good for you, yes?
What
Yeah,
happened
right?
there?
And also the microbial infection. Yeah, microbial infection. Yes, virus, Epstein-Barr, bacterial
Okay.
infection. So that's all risk factors, multifaceted. Yes. Another disease is also typically is type 2, could be type 4 and more, maybe type 2 as well. Diabetics mellitus, right? So, what you need, you heard of diabetes, right? The insulin, this, that, other. Yes? Okay. Now, type 1, type 2. Type 1 due to reduced insulin production. Type 2 typically due to the target cell have less sensitivity towards insulin. Yes? So let's look at type 1. So, what type of antigen located on where? On the surface of what? Pancreatic beta cell. So that's the cell produce insulin. Also, these cells have autoantibody bind to it, the cellular damage. When those cells damage, guess what? You're not going to produce look at the gamut. See, it's very easy. It's biopsy. Okay. Now, another autoimmune disease also related to the type 2 hypersensitivity is good pasture syndrome. Good pasture syndrome is talking about antibody target on what? Collagen, type 4 collagen in the lungs and kidneys. Right, type 4 collagen, the lungs and kidneys. So when you have those type of damage, so the symptom is associated with the function loss associated with lung work. Yes? How do we know with the autoantibody target down exactly where? What you do, you use immunofluorescence antibody by influenza diet. Okay. Now another disease, this one that who can see this?
Oh dear.
Chiropractor, right? You see, you produce autoantibody target on what type of antigen? Called desmoglein protein. So desmoglein protein is the protein kind of bind to all the cells, connect all the cells together. So you have a antibody bind to desmoglein protein. Guess what? Inflammation. You see the inflammation, cellular damage, right? So that's the Pemphigus vulgaris. Yeah, restraint. Yeah. Now, another one is we don't look at is damaging effect not go through the complement activation, rather is what? Antibody dependent cell mediated cytotoxicity. So this how that works is antibody antigen bind. The Fc region of antibody could recruit other cells. What are the cells? Natural killer cells, neutral cells, macrophages. So when they recruit those cells, then the ADCC could cause cell damage. Yes? So let's look at so this is a review. So this CDC, ADCC, CDCC, all that is worked by which fragment of antibody? Fc region of antibody. You see ADCC, right? Fc region of antibody recruit phagocytes, natural killer cell. Yes? And the opsonization Fc region, right? C3b recruit what? C3b recruit phagocytes. Fc region of antibody also can recruit macrophages. Yes? So CDC is talking about the MAC. Yes? So you see different mechanisms of killing the cells. Yes? Okay. Now, another one is kind of interesting. You guys learned the neuromuscular junction, how that works. Acetylcholine, have you learned that? Yes. Awesome. Good. Now we can apply that in here, right? So myasthenia gravis. Myasthenia gravis, you produce autoantibody target on what? Acetylcholine receptor. Acetylcholine receptor, right? On the skeletal muscle cell membrane. Yes? So when you have an autoantibody block the acetylcholine receptor, what's the symptom?
Are you sure? No, he has.
And
He was
then
talking
is
about it the other day. It might not
IgG
be.
could cause placenta give to the baby. So if the
No, it's
baby
definitely,
born with mother have a
he's
what?
definitely got it.
Myasthenia gravis. So you see,
Yes, I'm
right? The baby have a
almost entirely certain of that.
muscle weakness as well. Yeah.
Almost,
So
I
this
could be wrong.
which type of hypersensitivity? Type 2, because acetylcholine receptors on the cell membrane of your skeleton. Yes? Now, another disease, Graves' disease. So Graves' disease is autoantibody neutralized which antigen? Thyroid stimulating hormone receptor. So, have you learned the thyroid TSH, the endocrine? You learn that? Little bit? Okay. Let's see. There's which organ produces TSH, thyroid stimulating?
Five.
Hypothalamus could activate it. Yes, yes, thyrotropic releasing hormone produced in the hypothalamus. And that hormone activates which one? Anterior pituitary gland. And anterior pituitary gland produces bind to what? To the thyroid hormone receptor on the cell membrane of the cell in the thyroid gland. Yeah, right? Make sense? So if you, instead of hormone binding, and the antibody bind to it. So the cell, thyroid cell, right, doesn't have receptor. All of a sudden, the receptor bind to the thyroid hormone receptor bind to antibody. So that binding, the same we bind to TSH, but it actually is antibody. So once the cell have that receptor bind to it, what's it going to do? That cell is going to go through signal transduction, which is what? Thyroid hormone. Then you have what? Hyperthyroidism. Make sense? Right? So, and then what's the function of thyroid hormone?
Metabolism.
Metabolism. So you have increased metabolism and the symptom. Who can see the symptom? Right? See? Yeah. Now, pernicious anemia. Oh, pernicious anemia. Anemia. So pernicious anemia symptom relate to what? Anemia is reduced red blood cell. Symptom relate to what? Vitamin B12 deficiency. Vitamin B12 deficiency. So which cells kind of involved in like absorb vitamin B12? Guess what? So, right, stomach cell, beta cell, stomach cell, and then there's also intrinsic factors involved. Yeah. So if you have antibody binding to the vital cell in the stomach lining, or the intrinsic factor binding protein, the receptor on the ileum, guess what? You could have some kind of vitamin B12. That's pernicious anemia. So autoimmune disease. So this is typically a secondary. Primary symptom typically associated with what? Autoimmune gastritis, celiac disease, Crohn's disease, you heard of those? And then secondary pernicious anemia. So the treatment you have to do vitamin B12 supplement, this and that. Yeah.
Wait, so B12s to treat the pernicious anemia, but not Crohn's disease?
So the Crohn's disease, so some Crohn's disease patients also have pernicious anemia. So you have to treat with, with autoimmune disease, whatever treatment for Crohn's disease plus vitamin B12.
What is the treatment for Crohn's disease?
Treatment for Crohn's disease inflammation. You have all kind of treatment. Mild one, it's inflammation. You could have steroid to reduce inflammation, and then severe case. Some of those disease, celiac disease, you have to do the gluten-free diet. But severe case, they do what? The fecal transplant. Normal microbiome. You eat yogurt to reduce inflammation, right? Immunosuppressive, or you can do the fecal transplant. So, right. And plus, we have a low red blood cell count, vitamin B12 deficiency, you eat a lot of brain stuff, plus vitamin B12 supplement, right? Make sense? Depend on the symptom, you just eat. So pernicious anemia is which type of hypersensitivity? Type 2. Okay. Now, celiac disease. So celiac disease, they discovered that the gluten actually is one type of peptide called gliadin peptide. So this peptide induces the immune response targeting on what? Endomysium of smooth muscle in the GI tract. So the GI tract, you learn GI tract, right? You have what I call the peristalsis due to smooth muscle, right? Circular smooth muscle layer versus the longitudinal peristalsis. So you have endomysium membrane damage. Guess what? You see. So this one, the management besides reduce inflammation management is avoiding the allergen, right? Gluten-free diet. Okay. So chronic condition could lead to what? Pernicious anemia. Yes. Okay. Now we sort out the type 1 and 2. Now what is type 3? Okay, we're going to compare contrast, right? Type 3. What type of antibody involved in type 3? IgG or IgM? What type of soluble antigen antibody binding. That complex activate what? Complement system, include neutrophil, eosinophil, etc. Yes? Okay. So what's the difference between type 2 and type 4, type 2 and type 3 hypersensitivity? What's the difference between type 2 and type 3 hypersensitivity? Because both of these involve IgG and IgM type of antigen. So type 2 is the cellular antigen. Type 3 is what? Soluble. So where the antigen come from? Could come from infection, could come from environment, could be some autoimmune disease. Type 3 hypersensitivity. Yeah. Right? So they form an excessive antigen antibody complex. So infection typically comes from a chronic disease. You see chronic disease, you produce antibody, antigen still there, antibody produce, antigen still there. Yes? And then if it's not cleared away, so who's clearing it? Complement system. So if you have a really good complement system, you less likely have type 3 hypersensitivity. If you have mutation or weakened complement system, you more likely have type 3. Okay? And then the autoimmune disease could be like a systemic lupus, erythematosus, rheumatoid arthritis, or localized, example, arthritic accent Parkinson. We're going to look at glomerulonephritis. Let's look at type 3 hypersensitivity. Could be drug induced. You see, type 3 disease, right? Strep throat, streptococcus, right? Infection left untreated, right? Could be meningitis, hepatitis B and C. Could lead to type 3. Mononucleosis, malaria, trichinosomiasis. We don't know those, right? All those diseases it's hard for immune system to clear away. It will be persist for years. Then you have damage in the other organs due to what? Type 3 hypersensitivity, including autoimmune disease or drug abuse. Yes? So let's I like this picture. This will give you a clue. So you see soluble antigen antibody. That means some microorganisms you produce antibody, they kind of resist to it. So you have antibody antigen that's constantly there. So antibody antigen complex could migrate through the blood vessel, then lodge in where? In tiny blood vessel. You see joint have tiny blood vessel, heart, lung have tiny blood vessel, skin, the capillary bed, and kidney, the glomerulus, tiny blood vessel. Once it lodges there, it cannot move. Once it lodges there, guess what? Antibody antigen can activate what? Complement system, MAC formation. They could include the neutrophil macrophage phagocytosis. You see this blood vessel damage. Once you have blood vessel damage, you're going to have what type of symptom? You have rash on the skin, you have glomerulonephritis, right? You have rheumatoid arthritis, you get an idea. Yes? Yeah. That's type 3 hypersensitivity, right? Another type 3 hypersensitivity is serum sickness. Serum sickness comes from what? Passive immunity, right? Artificial passive. So what's the difference between artificial passive versus artificial active? Right? Artificial active is what?
No, I don't. 1 second.
Vaccination. Artificial active vaccination rely on memory T cell, B
First name is
cell is
Billy.
used
I don't know his
for
last name.
prevention. Artificial passive rely on what? Antibody in the serum. So artificial passive is used for what? Treatment. So when you use artificial passive for treatment, depend on what type of serum. If it's human serum, you less likely have a serum sickness. For example, over here you look at a snake bite. Poison snake bite. You use a horse anti-serum. Then your immune system going to have the action towards the antibody from the horse. That's what. Make sense? So that's why you see a lot of monoclonal antibody or human, this genetic engineer, they make the antibody come from animal, knock it out, make it into human, reduce the serum. You see? Right, everyone? Follow so far? Okay. Another thing is arthritic reaction is talking about the skin reaction. If somebody do the excessive TB test, vaccination. For example, example, this case, the patient will get a tetanus shot. And then like, I forget to have the document. They asked me to get another tetanus shot so that we have a document to see I can get reimbursement, for example, right? So you have frequent vaccination. When you have frequent vaccination, you have a lot of immune complex, lots, injection site. So that's the type. Yeah, make sense? Right. Another one example of type 3 hypersensitivity is farmer's lung. Farmer's lung, why is farming? Because farmer's lung, right? Inhale the mold, fungal mold, inhale the dust, this antigen persists in the lung. So that you have a persistent antigen antibody in the lung, you have lung damage. That's fine. So how do you prevent farmer's lung? Good job. Right? Okay. So another one is autoimmune disease, major reaction type 3. Is you produce antibody against this protein in the nucleus. So how do you get that reaction? How do you see the antigen in the nucleus? So which sex more likely have a lupus? Male or female? Female. A lot of times the female after pregnancy, so apparently the female hormones is involved in autoimmune disease. But anyway, right? What happens is your cell routinely die. With the skin cell routinely small cell in the GI tract, the mucous membrane, every time you die, stay, probably some cell death will involve in that. Yes. So when the cell die, guess what? In general, like the complement system clear away, homeostasis is cleared away. But if you have typically associated with complement system, if the function is kind of reduced, then you have these dead cells, nuclear antigen persisting there, it's not cleared away. Then your immune system, like, hey, we just keep saying this antigen, something wrong with it. We start. Yes. So maybe it's type 3. But if occasionally, if the antigen associated with the cell memory as well, we put type 2. But anyway, so let's look at the type 3. So sometimes, if you have a reaction inflammation, right, underneath the skin, that's what typically lupus have butterfly rash on the face. Yes, because type 3 hypersensitivity antibody antigen lodged in a tiny blood vessel, capillary bed underneath the skin. You see the inflammation. That thing. Yeah. Another thing is this immune complex could lodge in the kidney. So typically, lupus patient later on, a lot of them require a kidney transplant and glomerulonephritis. Now, how do we diagnose somebody with lupus? How do we diagnose? Yeah, you can do the blood test. You can do immunofluorescence. You see the nuclear antigen light up. Sometimes you can differentiate the SPECT versus diffuse versus SPECT. So kind of give you a clue about this lupus, how severe, like a PCR. Okay. Another autoimmune disease, the majority of them, type 3, occasionally type 4 is what? Rheumatoid arthritis. Right? Rheumatoid arthritis. So basically it's inflammation, immune complex lodged. So this is obviously very easy. Yeah, very easy to see the rheumatoid arthritis symptom, right? You see that? Now, why some people have rheumatoid arthritis, right? Typically this disease occurs later in life, you think? Yes? So you can see multiple factors involved here. So, Porphyromonas infection is actually involved in what? Gum disease. You have persistent gum disease, increased risk for rheumatoid arthritis. That bacteria typically associated with periodontitis. Yeah. And then you have what? Smoking is not good for you as well, right? Yeah. And what else? And then you have infection. You have asymptomatic, say you have infection. And so gradually, sometime 50, 60, finally. So it's a long term, many factors involved. Okay, so that's rheumatoid arthritis. Now, 4, however, its disorder associated with what? Cell meeting. Yeah, cell meeting. The key help 1. So we're going to, I have a topic discussed, I have new article on that lesson. So nowadays, they have more understanding about this type 4 hypersensitivity. They have, remember the T helper 17, T helper 9, besides T helper 1, T helper 2, we learned T helper 9, T helper 17, T helper 22, T helper Treg, yes? So now recently they have more understanding about different types of type 4. For now, we just for the passing of the word for this class purpose, we just use T helper 1 as example, okay? We can see cell-mediated immunity is very important for what type of effects, intracellular or extracellular. Remember, human immunity, cell-mediated immunity, one is really effective for clear the extracellular infection, one is really effective to clear the intracellular infection, right? Cell-mediated immunity is effective for what type of infection? Intracellular or extracellular. Intracellular. So cell, this is a review, right? Cell-mediated immunity, they are very effective to clear the intracellular infection. Humoral immunity, they are very effective to clear what? Extracellular infection, because antibodies in the plasma and the extracellular. Got it? So now, type 4 hypersensitivity typically associated with what? Intracellular pathogens. You see? Remember, the tuberculosis is what? Intracellular bacteria. A lot of viral infection, obviously, is what? Intracellular infection. The Leishmania, that's also intracellular, it has to go inside the macrophage, right? You have persistent intracellular infection could lead to what? Type 4 disease type. In addition, some of the contact allergic to the post-IV or the contact lens, whatever, right? Contact. So some people allergic to the leather, the metal, this kind of. Yes? Okay. So now let's look at the type 4 hypersensitivity type. What does that mean? So again, the symptom really is a repeated exposure, right? So for primary infection, you're sensitized because you activate, we just use T helper 1 as an example. T helper 1 is activated, sensitized. And the persistent infection, guess what? Persistent infection, what's the function of T helper 1? T helper 1 could activate which cell? CD8. CD8 become what? Cytotoxic T cell. So effector cell in the cell-mediated immunity is what? Cytotoxic T cell. You see? So the next time the cytotoxic T cell gets activated, so you have cellular damage. In addition, T helper 1 also activates macrophage. Macrophage activation, so you can activate macrophage, they typically start to quarantine granuloma tissue formation. So granuloma tissue formation due to active macrophage and the cytotoxic T cell activation causes cell damage. Yes? So that's a symptom associated with T helper, the TB type, right? So over here we reviewed. So this is different type of T helper cell subset. Yes. So T helper 2 active B cell produce what? IgE. So that's type 1 hypersensitivity, right? And T helper 1 active cytotoxic T cell and active macrophage. That's type 4 hypersensitivity. See? Make sense? So different T helper cell subset. Now, what's the symptom? So granuloma tissue formation due to active macrophage. The symptom, usually one of symptoms we can see is, for example, somebody has tuberculosis skin test. So the tuberculosis, you have tubercle in the lung. What is the tubercle in the lung? That's the granuloma tissue in the lung, type 4. You can also do a skin test to see on the skin as well. See? Right? So tuberculosis skin test is an example of what? Type 4 hypersensitivity. Why is delayed? Why is delayed? So this one we can compare with type 1. So type 1 hypersensitivity, once you repeat the exposure, you have immediate reaction. For type 4 hypersensitivity, that's another example for type 4 hypersensitivity. We're going to use the poison ivy as example. Poison ivy produces a chemical, it's a peptin. So the heptans from the poison ivy, once you contact skin, the heptin going to bind to the protein. It's called the uracil. So uracil is a chemical associated with poison ivy. Once contact skin, you have tons of protein on the skin. That's once contact your skin protein, together become allergen. When it together become allergen, they're going to go activate what? T-helper-1. The T-helper-1 sensitizes. So second time you encounter the same poison ivy. So the T-helper-1 going to activate what? Cytotoxic T cell. Cytotoxic T cell will kill that skin cell. The skin cell have a protein bind to the uracil. Yes? They said sensitized T-helper cell can also activate a macrophage. Macrophage increase macrophage. They said sensitized T-helper cell could recruit what? T-helper 17. T-helper 17 increase inflammation. You see? Right? So that's contact dermatitis. Yes, type 4 hypersensitivity. Now let's look at the autoimmune disease associated with thyroid gland, right? So you can see the Graves' disease, simply antibody bind to the thyroid hormone receptor type 2. For the Hashimoto disease, what happens is you have autoantibody, right, activate type 4 hypersensitivity before the cell to the thyroid process. In addition, right, you see that cytotoxic T cell come in, right? Cytotoxic T cell come in. So you have lots of cellular damage in the Hashimoto disease. So when you have lots of cellular damage in the Hashimoto disease, then you do not produce enough thyroid hormone. So we call it what? Hypo. And over here, that's the early stage. Later stage, once they bind, the later stage, the Graves' disease could turn into Hashimoto disease. Okay? Right? Because antibody bind there, you know other cells in the complement system, and the cell will come. Yes. Right? Okay. Now, next couple of slides actually come from this topic. If you go to the blackboard, right? Go to week 8 discussion, I have this literature. This literature is a kind of linked to T helper cell subset with different type of hypersensitivity type 2. So in this paper published already, last year, it's new. So I just want you guys to read this literature to understand nowadays they actually differentiate even type 4, type 2 have A, B, so have different subsets because they link the different T helper cell subset linked to different type of hypersensitivity. Even type 4 have different mechanisms. Right? So in that discussion, I asked you guys to look at, for example, drug induced. So these two examples, drug induced with acute generalized exanthematous pustulosis. Both of these typically occur in hospital. Patient already under stress, taking medication, either IV or orally. Then you have severe reaction. So one type is drug rest related to eosinophil. So those type of disease, the patient after taking medication, they have hepatitis, intestinal, interstitial nephritis, all these serious disorder due to what? They recruit what? Eosinophil. Right? Another type is the skin reaction, blood pus, due to what? The type 4 hypersensitivity drug induced and recruit neutrophil. When they have a lot of neutrophil, increase inflammation pus formation. See? Right? So this one is related to what? T helper 17. Yeah, T helper 17. So you see, nowadays with more understanding about the different T helper cell subset, and even the hypersensitivity become more complicated. Even type 2, type 4, you have A, B, C, slightly different type of reaction based on what type of cell, additional cell. So I'm just wondering, so for our exam purpose, you don't have to look at those because it's relatively new information. Streptococcus glomerulonephritis is what type? Type. Yeah. So this is what? Type 3. Good job. Good job. Asthma, hay fever, jellyfish stinging. Type 1. This is type 1 intermediate, right? Graves disease. Graves disease. Graves disease.
2.
Type 2, yes, because of the antigens on the cell surface, right? Type 2. Tubercular skin test. Allergic contact dermatitis. Type 4. Pernicious anemia. Pernicious anemia. Type. Pernicious anemia. Type 2. Type 2. Type 2. And reaction to the incompatible blood transfusion. That's type 2, right? Myasthenia gravis. Type 2. Rheumatoid arthritis. Rheumatoid arthritis is immune complex deposit on the joint. Mainly is type 3. Rheumatoid arthritis type 3, occasionally type 4. Okay, type 3. Lupus. Yeah. Lupus mainly is type 3, maybe type 2, type 3. Okay, both type 2, type 3. And erythroblastosis fatalis, type 2. Yes. Okay? Right? So now, this table summarizes additional common autoimmune disease. At this point, I think when you read the table, you can figure out what's going on. Yes? Okay. So now we finished the hypersensitivity and autoimmune disease example of it. You guys ready to use the knowledge check? Yeah? And if you have time, you can always read that article, yes? Kind of help you to understand the involvement part of science. Yeah.